When all you have is a hammer, everything starts to look like a nail. Hi, I'm Dr. Stephen Anderson, and in healthcare, this is especially true. We are often asked to work harder and not necessarily smarter. And I'd like to provide a recent example of this as well as what I did to correct it. Our company was tasked with coming up with clinical decision support, or CDS rules, for another company. We were provided a web page that allowed our rules to be tested against the customer's server. Our company's initial solution for needing to clinically vet the CDS rules was to have more clinicians assigned for a longer time to make sure that the rules were working properly. Let's look at the rules that we were given and get a glance into what we were asked to do as clinicians. Here we see the webpage that we were given to do our testing on, and we are assigned the task of testing our breast cancer rules. And as you can see, it is quite a long webpage that we had to go scrolling up and down on. So for testing our breast cancer rules, of course, we'll want to be able to put in the patient age. So we would go around searching for that, and then after we found that, we'd probably have to go find the gender, because we probably wouldn't want to include male patients in our breast cancer results at this point. We'll also need to find their past medical history of breast cancer, and we'll have to do this multiple times depending on the different clinical scenarios that we had come up with. We would want to know their what their clinical breast exam was like, so we would select something here as well before sending that off to the server. If they did have breast cancer that was known already, we'd want to put in the TNM stage. Our initial solution for this was to assign 6 or 8 of us at $100 an hour to make sure that our rules were properly vetted and would not result in any patient harm. The executive in me hated this because we had a room full of people making well over $100 an hour who were spending their time going up and down a poorly organized web page. As clinicians, we did get faster, of course, at finding the different values, but this is a good example of working harder, not smarter. Fortunately, our leadership at the time was amenable to me taking an hour or so, and using JavaScript I was able to reorganize the web page, and I was able to quickly reorganize it in a clinically relevant fashion. This change allowed us to become drastically more efficient. We could have asked one of our software developers to do something similar, but this oftentimes resulted in multiple meetings with multiple less than optimal iterations. So thanks to my intervention, we were able to provide a better product to our customer because we were able to find issues with the CDS rules much more efficiently. We also were able to finish the project ahead of schedule, which also made the customer happy. Finally, we freed up our clinicians to think about clinical problems instead of being involved with busy work of scrolling up and down. I am Dr. Stephen Anderson, Principal Consultant for healthitmd.com, and we, by combining clinical expertise with extensive software and database development experience, create solutions to today's vexing IT challenges quickly and with unparalleled clinician adoption.